Hey there! So today we're going to talk about 3 things that you can do in order to prepare for a first session with a sex therapist. And it's actually really surprising because most people don't even know that my profession exists. They think that I'm joking when I tell them that I'm a sex therapist. So if you are one of those people who has decided that working with a sex therapist would actually be really beneficial for your treatment and your life, then you'll really want to pay attention to these 3 tips. And also I've got some bonuses at the end that I teach my clients and they find to be very, very valuable. Hi, I'm Kayna Cassard, and I've been helping vulva owners and couples deal with the difficulties and the impact of pelvic pain, mismatched libidos, and just overall intimacy issues since 2006. Now today we're actually going to be talking about 3 things that you can do to prepare for a first session with a sex therapist. And a lot of people actually don't even know that this is a profession, and which is so odd because I actually heard about this profession the first time when I was in elementary school. I think some boy was talking about it and teasing the girls with it or something. I don't remember what the context was, which kind of concerns me now that I think about it. But I do remember first hearing about it then, and then of course it was in what's that movie, Meet the Fockers with Ben Stiller, and that was great. It's so hilarious. But still people don't even know that it's actually a real profession. And so I'm going to actually quickly talk about what a sex therapist is. So it's a licensed mental health professional who's regulated by a governing board of either the state or the nation. And basically, beyond the schooling and education and the requirement for clinical hours that we need to obtain in order to become licensed. Oh, and the test, we have to take a grueling test in order to get licensed. So beyond that, we've done additional work in sexual health topics and sex therapy training. So if you've decided that working with a sex therapist could actually really benefit where you're at, what you're struggling with, then these are 3 things that can help you prepare for your first visit and then beyond, of course. So the first thing that you're going to want to do is prepare and know your medical history. Now, a lot of people don't realize that mental health and emotional health are actually very much intertwined in being able to identify what's going on and figure out how to work through it. So medications, medical conditions, surgeries, all of those things will be really helpful for your sex therapist to know, even if you don't think it's related. It might not be, but if it is, then it'll be important for them to know, because the first thing we're trained to do is rule out any medical conditions that might be causing the sexual issues you're facing. So for instance, thyroid problems, unmanaged thyroid issues, can cause depression, which then could also cause a lack of sex drive, lack of libido, lack of interest. If you're having any hormone issues, so low testosterone can cause vulvar pain by thinning the tissues of the vaginal opening. Low testosterone can also cause erectile issues in men or people who own penises. Birth control use could also impact it largely because of the hormone fluctuations that happen. And then other emotional or mental health issues that you're dealing with. So if you have depression, anxiety, OCD, a personality disorder, all of these things are really important for your therapist to know, because they are mental health therapists, and because they're healthcare providers, they also see the integration of these 2 worlds coming together. And if they determine that you do need some additional medical rule out, they will refer you to your doctor, or they'll probably have suggestions for people who have the sexual health component in mind as they're treating their patients. So the number 2 thing will be to make a list. So it's so helpful to list out the symptoms you're experiencing, how frequently they happen, when you first noticed them, what makes your symptoms worse, better. Also, a life or relationship history can help. You might not share that your entire life history or biography with your therapist in the first session, but it'll be really key for you to be able to know some really important components to share with your therapist. Also, what's really important is, of course, what's happening in your relationship or intimate life. Now, you might be single, and so that would be important to tell your therapist of like, what dating stresses are you dealing with if you're dating? If not, why? If you're in relationships, how the symptoms that you're experiencing are impacting your relationship. It's so surprising how sometimes when you fix the relationship issues, like the tension, the power dynamics, the fights, it can really shift the way that you are able to show up sexually. All right, so the number 3 thing is to make sure to discuss any cultural or religious concerns that might get in the way of your therapy, your therapeutic relationship, or your therapy progress. So you want to make sure that your therapist is going to be a good fit for you. So if you have very specific belief systems that you do not want to break from or that are important for you to hold to, that will be important for your therapist to know. There are some sex therapists or even therapists, but we're talking about sex therapists today. So there are some sex therapists that have a very specific understanding or belief system around sexual health practices, and they might not be a good fit for you if those belief systems clash. Now, there are therapists who have great cultural diversity and an understanding of different belief systems and the impact on sexual health response and sexual health wellness. And so those people, those therapists are going to be able to likely work with people who have different belief systems, and they can work like well with it because it's not about the therapist and the therapist's belief systems. However, there are some things that certain therapists just will not go outside of their value system. And so if you're going to have something that so if you're going to have something that could potentially create some conflict in your treatment, that'll be something that's really important for your therapist to know to make sure that you two are on the same page. So today we talked about the 3 things that will be helpful in preparing for your upcoming first visit with a sex therapist, or maybe you just needed to watch this video and learn about what to expect in a first session, and that's great. And if you need suggestions for sex therapists, I am more than happy to help. You can shoot me an email at hello@kaynacassard.com. Also, you can check out asect.org, which has a great list of certified sex therapists, educators, counselors. And then also, one thing that I find to be really helpful for my clients is that they keep either like a pain diary or a sexual health diary or journal or daily log so that they can keep track of what ends up creating a worsening of their symptoms and what makes things better. And so that can be really helpful to just jot down at the end of the day so that you can start to see patterns and make any changes where the patterns are not looking so great for you. So I hope you enjoyed that. We talked about the 3 things to be able to prepare for your upcoming therapy session with a sex therapist. And if you like this content, you'd probably like a lot of my other videos on pelvic pain or sexual health and intimacy, relationship challenges. All of those things are covered. So make sure to subscribe, hit the notification so that you don't miss anything. And also, when you subscribe, it helps tell the powers of YouTube that this content is helpful for other people like you who need that support, need something educated, and need some really good, helpful guides. So help me help them by making sure you subscribe. Thanks again, and see you around soon.